Hello and welcome to my channel, guys. I am Dr. Aparajita.roy and today we're going to talk about PACES Communication Station or Station 4. This video is part 1 of a 2-part video series on PACES Communication Station. In today's video, we're going to talk about the format of the exam, the marking scheme and the preparation resources. In the next video, I'm going to give you 5 exclusive tips on how to pass this station with ease. So let's get started. Now, Station 4 or the communication station is a very important part of the PACES exam carousel. Personally, I find this station very unique because before MRCP, none of the medicine exams that I have taken have tested my communication skills as a doctor. And as I have progressed in my career as a doctor, I have found that your communication skills are as important as your clinical skills. How you interact with your patients or your patients' relatives or your colleagues is actually an art. And in order to master this act, you have to practice. Now, why is this communication station an integral part of PACES? The reason is NHS has set guidelines, a sort of set criteria as to how they expect the doctors or other healthcare professionals to interact with their patients or their relatives. And through this station, the RCP is testing whether the candidate has the required soft skills that is expected from any doctor in the NHS. First, let's understand the format of the exam. Now, if you ask anyone, they will tell you the PACES communication station lasts for 20 minutes. But in my opinion, the whole station is actually a 25-minute affair. I'll tell you why. The first 5 minutes actually begins outside the room or outside your station where you're given a clinical scenario. Now, these 5 minutes are extremely important. They are an integral part of your exam, and how you prepare your pre-communication notes in these 5 minutes is extremely important, as this will define the structure and progression of your communication station. Watch my next video, that is part 2 of this 2-part video series, where I will discuss in details how you can make the most of these 5 minutes. After these 5 minutes, the actual communication station starts. Traditionally, in the face-to-face version of this exam, you would be in the same room as the surrogate or the actor along with 2 examiners. The examiners will be mute spectators throughout your interaction with the surrogate, and very rarely they will interrupt your conversation only if they think the surrogate is not sticking to the script or if the surrogate is digressing. But otherwise, do not expect any reaction or any intervention from them. Presently, this station is now happening remotely, where you enter the room and you face a computer screen. The time starts as soon as the surrogate appears on the screen, and then you start your conversation. You are expected to open the conversation, organize the structure of the interview and progress for the next 14 minutes. At about the 12-minute mark, the examiners will prompt you regarding the time that only 2 minutes are left. But I strongly recommend that you carry your own pocket watch so that you can keep a track of time throughout this conversation. You do not want to reach the 12-minute mark and then realize you haven't talked about the most important points in your conversation. Now, at exactly the 14-minute mark, the surrogate will disappear from the screen and you will get 1 minute to gather your thoughts. Again, this 1 minute is extremely crucial and is an integral part of your communication station. Please watch my next video, that is the second video of this 2-part video series, to know how best to utilize this 1 minute. So 14 plus 1, 15 minutes of the 20-minute station is already over. What is left is a 5-minute interaction with you and the examiners. They will ask you relevant questions, some theory questions pertaining to the scenario that you have just interacted in, and then conclude this session. Now, please remember that the examiners are under strict instructions not to divulge any emotions or not to give you any idea as to how you're performing in this station. So do not be distracted by the fact that they are taking a lot of notes or they are not giving you any expressions. They are not supposed to. Now let's understand what's the marking scheme of this station. IMGs or international medical graduates are notorious for failing in the communication station. This is because, like I mentioned, we are not really taught or not really prepared for these sort of communication or interaction type scenarios. UK graduates, on the other hand, they are quite adaptive to these situations because they've been doing this since their medical school days. So expectedly, they do quite better in these scenarios. That is why, as your mentor, I strongly recommend you not to take this station lightly and prepare very, very well for this station. So first, let's understand what are the boxes that you have to tick in order to get maximum marks in this station. Let's first understand what is the candidate expected to do. You're expected to lead the conversation with the surrogate, extract relevant information from them, and navigate through the conversation while applying your clinical skills and ethical knowledge to arrive at a reasonable conclusion and agreement with the surrogate. You should be emotionally supportive, empathetic, but at the same time maintain your professional boundaries all along. Know your limitations and don't overstep your mark and never ever give out wrong information. Now, overall, this station may seem very, very intimidating, but this is something that we do in the NHS every day, and as a prospective MRCP candidate, you will be expected to do the same. Now, let's look at a scenario to understand the marking system clearly. Here, the candidate, who is a medical doctor in the ward, is asked to explain a perceived drug error to the surrogate, who is the patient's daughter. Pause the video here. Read the scenario carefully and formulate your own conversation points, and then see if this matches the recommended guidelines by the RCP. In the PACES communication station, the candidates are being tested for 4 skills. The first is clinical communication, where you are expected to extract information and give advice in a clear, structured, systematic manner. Now, many candidates are confused whether they should or should not take any history from the surrogate in the clinical communication station. Now, if you look at this scenario very, very carefully, you will see that this piece of information is not divulged in the candidate information sheet. If you do not get to this bit, you may not fully appreciate why the patient's daughter is so anxious and hence may not be fully empathetic towards her situation. So, my suggestion is to use your own judgment. Don't go off topic, but you may need to extract some relevant key information from the surrogate during your conversation. For this scenario, these are the recommended points that you must discuss in order to score full marks for this section. The next skill is clinical judgment. You have to apply your clinical knowledge to negotiate a sensible management plan that is best suited for this specific scenario. In this case, this would definitely include involving other family members in the decision-making process. And here you can fully appreciate why relevant history taking is key. Otherwise, you will lose a mark if you cannot extract the information from the surrogate about family members living abroad. The third skill is managing patient's concern, and this is very, very important for this station. You have to ask, listen, and confirm. Now, in the NHS, during our day-to-day interaction with patients and patients' relatives, we use the ICE approach, which stands for ideas, concerns, and expectations. When you ask the surrogate, do you have any concerns or questions, she will ask you a set of standard questions. This will be scripted so that the exam is fair towards all candidates. How you reply to her will determine how you are marked in this station. For this scenario, you have to emphasize that the patient's condition is poor and the risk versus benefit of aspirin in her case needs to be further explored. The last skill is maintaining patient welfare. Now, this is pretty straightforward as long as you have not argued with the patient or the surrogate or not caused any significant distress or discomfort to the surrogate and have treated them respectfully, you should be able to score full marks in this skill. Now, what is the marking criteria? For each skill, you will be marked by 2 examiners, and if you have ticked all the boxes, they will give you the full marks, which is 2 for being marked as satisfactory. 1 mark is borderline, where you have covered some topics but you have not managed to cover all the topics in entirety, and if they think that your performance was not satisfactory at all, they will give you 0 marks. Now, many candidates ask what is the pass marks for communication station. The way PACES is marked is that you don't pass or fail a station, rather you have to pass each skill across a number of stations. It is extremely important that you understand the PACES marking sheet in and out before appearing for the PACES exam. In fact, you should know it like the back of your hand so that you do not let any mark slip. The marking scheme is a bit complicated, but it is quite well explained in the MRCP website. But if you still have confusion and if you still want to understand the marking criteria in details, let me know in the comment section below and I'm happy to make a video on it. Now let's talk about the preparation resources that you should use to pass this station. So if you are familiar with my previous videos, you would know that my approach to PACES preparation is very simple and very structured. I always recommend that start with online PACES videos from a good PACES course provider. And the same holds true for communication station as well. That is because it is very challenging to master the live interaction skills just by reading a book. See how the candidate is interacting with the surrogate with not only words but also with the non-verbal cues like hand placements, smiles, head nodding, and these soft skills, this intonation of voice. These are the things that I want you to pick up from these online videos. Emulate these candidates, pick up their phrases and pick up their body language and then make this a part of your own vocabulary. Now, I strongly recommend these online videos from Past Test or Clinical Skills Pro, but you can also watch a lot of resources that is available on the MRCP UK website. If you work in the UK, you have an added benefit. You can watch your UK colleagues. Like I said, they have been doing these all their lives and these skills come naturally to them. Just by watching them, just by being around them when they do this sort of communication, you will learn a lot. And then when it's your turn to enact these real life scenarios, ask your UK colleague to watch you and then give you serious feedback. Thirdly, as I always say, invest in a good course. Don't cut corners while investing in a good course and make sure these courses are done by a UK instructor who has substantial NHS experience, as only these instructors will be able to tell you the exclusive do's and don'ts in the NHS. Lastly, here is a list of books that you can follow as a part of your PACES communication resources. Now, I quite like Rider because it has an extensive list of scenarios for your PACES communication station. Go through each of them one by one and do not cut corners when reading Rider. You have to know a little bit of theory, including the DVLA guidelines and a little bit about the ethical and legal situations in the NHS. You can get that from Pocketbook for PACES or Rider. You can also go through the GMC Good Practice Guidelines that is freely available over the internet. Now, catchphrases. I'm going to discuss this in details in my next video on 5 top tips on how to prepare for the communication station. But catchphrases are sort of some pre-prepared answers or pre-prepared statements that you can tell the surrogate when they ask you a certain question. You can learn more about it in my upcoming video, or you can go through them in the RCP Medical Masterclass booklet. Also, do not miss any of the sample scenarios that are given in the MRCP website. They are an excellent guide on what the RCP is expecting from each candidate in order to score maximum marks in this station. If you like this video, please give me a thumbs up and comment in the comment section to let me know how you found this video. Do not miss the part 2 of this 2-part video series, as there I will share 5 exclusive tips to maximize your PACES communication preparation. All the best, stay safe, keep studying and ace your MRCP.